name is Sydney Parker. How many people do you know with diabetes? Probably a few people. In fact, there are 37 million people in the US with either type 1 or type 2 diabetes. That is 1 in 10 people. Even with that many people in the US with diabetes, not many people are educated on the difference between the two types. With so many people in the US struggling with diabetes, why are we not educated enough on this topic? Not only have I researched this topic, I have also been surrounded by friends and family that struggle with both types of diabetes and have seen firsthand just how different the types are. Today I will talk about what the difference is between type 1 and type 2 diabetes and what the similarities are. First, let's understand what type 1 diabetes is. According to the CDC, if you have type 1 diabetes, your pancreas either doesn't make insulin at all or very little of it. Without insulin, blood sugar will build up into your bloodstream, which can cause many symptoms and complications. Diabetes can be caused by an autoimmune reaction. Only 5 to 10% of people with diabetes have type 1. It has no cure, but it is treatable. They inject insulin daily through a shot or pump. They check their blood sugar constantly. Some people have traits that pass down that give them type 1 diabetes, but that is unlikely. You can also get it through a virus. It typically appears in adolescence. It can last for years or be lifelong. Now that we know what type 1 diabetes is, let's learn about what type 2 is. According to the American Diabetes Association, type 2 diabetes is when your body doesn't use insulin properly and it affects the way your body processes glucose. Your body either does not produce enough insulin or it resists insulin. Some people control their blood sugar with a healthy diet and exercise. Some might need medication or insulin to control their levels. 90 to 95% of people with diabetes have type 2. Insulin resistance is when cells don't respond normally to insulin. Type 2 diabetes causes high blood sugar, which can cause heart disease, vision loss, and kidney disease. This may develop over several years and can be very noticeable. The only treatment is having a healthy lifestyle, and if that does not help, your doctor can prescribe you insulin. There is a risk you can get type 2 if you are pre-diabetic, overweight, 45 years and older, or have ever had gestational diabetes. Now that we know what the difference between the two types are, let's talk about what some similarities are. According to the Diabetes Research Connection, the causes and treatments for both types are very different, but there are still some similarities. Having a healthy diet is critical for both types. Lower weight and high activity increase insulin sensitivity, which controls blood sugar. Complications with blood sugar occur for both types, so they will need to keep an eye on it. Cardiovascular disease is common for both. Neuropathy, nerve damage, nephropathy, kidney damage, and retinopathy, eye damage, are common long-term effects. Extreme thirst, hunger, blurry vision, and fatigue are common side effects. Now that we have learned about both types of diabetes, let us review. Both type 1 and type 2 diabetes is a condition that affects 1 in 10 people in the US and is something that everyone should be educated on. There are many things that make type 1 and type 2 very different, but there are also a few similarities that can confuse people. With 37 million people in the US suffering from diabetes, chances are you probably know a few of them. I hope everyone can be educated on this condition so you can be aware of people around you and even prevent yourself from developing diabetes.